Dr. Partha Nandi joins us now to talk about the president's condition. And Dr. Nandi, the president is 74 years old, has a BMI that would put him in the overweight category. How does that impact treating him? Would it actually make it harder to treat him for the virus?
Okay, good points. You know, here's the thing. He's at higher risk because he's 74. In fact, he's got a 90 times the mortality risk of an 18 to 29-year-old. That's really important to know. And the other thing is that the information provided from the White House is that he's in the obese category. What that means is that the data shows that there's increased risk for hospitalizations, increased risk for dying from this disease. The positive thing is that the president is reasonably active, right? He golfs and walks, so that also helps him. But I think he has to be vigilant because he's got two high risk factors that could impact his life with the COVID-19.
And Dr. Nandi, what type of insight do you have on how the president would be treated for the coronavirus?
It's really important. I can't stress this more. Even if he's the president, we cannot deviate from protocol, which is science. I mean, we can't just try medicines that have not been shown to be effective. If he's has some symptoms and he needs oxygen, definitely he should get oxygen. But we shouldn't use medicines that have not been tried and have had trials that show efficacy. If he's hospitalized, we know that there's a couple of treatments: dexamethasone, which is a steroid, and remdesivir if he's hospitalized. But beyond that, I think observation, getting a lot of rest, and I'm sure he's going to get the best of care. I have to say, though, Keaton, this is a prime example. We have to protect ourselves, right? The most protected person on the planet is still get infected. We all have to wear masks and social distance. This is such an example for all of us to take action and make sure we don't get infected.
All right, Dr. Partha Nandi, our chief health editor, joining us live at noon. Dr. Nandi, thank you so much for your time and for your insight.